Well, they have. The last 2 days, it's been almost 3,000 cases per day. And what you have to do is put that against the backdrop of the previous 7 days, where on each of those days, the kind of case counts we've seen through testing have been in the range of, shall we say, 1,400 to 1,700. So this is a big change. It's now consistent over 2 days, and it is of great concern at this point. You know, we've been able to relax a bit over the summer. The disease levels have been really quite low in the UK through the summer, but these latest figures really show us that much as people might like to say, oh, well, it's gone away. And I just heard on the 6 o'clock news, one of your interviewees saying, well, it's gone away. This hasn't gone away. This is a virus we're going to have to live with. And if we're not careful, if we don't take this incredibly seriously from this point in, we're going to have a bumpy ride over the next few months. Well, people have relaxed too much. People have relaxed too much. And now is the time for us to re-engage and realise that this is a continuing threat to us. It's all very well saying that hospital admissions and deaths are at a very low level in the UK, which is true. But if you look further into the European Union, you can see that where case numbers rise, initially in the younger parts of the population, they do in turn filter through and start to give elevated rates of disease and hospital admissions in the older age groups. And we know that that then becomes a serious public health problem. This is very new news. I think public health policy officials and politicians are going to need a little time to absorb this, but they are going to have to think about how we manage this and how we do so, not in a short-term way, not about the next 6 days, not about the next 6 weeks, but about the next 6 months and how we get through this until the spring.